All right, so good morning, everyone. I'm Ruth Andrews, and my area of focus for the BA program was global health. And being an on-off resident of northern BC for most of my life, and because health in rural, remote, and northern contexts is a big part of global health, but is underexamined, I was quite excited to come across my host organization's work online. And specifically, this gave me the chance to explore gender-based violence in these communities, especially domestic violence and intimate partner violence. And before continuing, I'd like to acknowledge that I'm speaking today from the unceded territory of the Gitxsan First Nation, also known as the Hazeltons and Upper Skeena region. This was my home base during my practicum, and after spending most of my youth here, I am very grateful to this community and the land for helping to shape who I am today. And my hosts and most others who were part of my practicum experience are based on the unceded territory of the Lheidli T'enneh in so-called Prince George, BC. And just to note that all the photos in this presentation, with the exception of this one of UNBC and Prince George, I've taken all of these over the years just around the north. So I was very glad that I got to work with such a multidisciplinary team. Those closest to me know that that word multidisciplinary is like the story of my academic life so far. So my host organization, the Northern Feminist Institute for Research and Evaluation, or Northern FIRE, was an ideal fit since the leadership team represents the UNBC departments of history, women's and gender studies, and social work, which, fun fact, was actually my other program of choice when I first applied to UVic. So I just wanted to recognize my hosts, founding member Professor Dawn Hemingway, Dr. Indrani Margolin, and Dr. Jacqueline Haller, and all of their work for women's health and well-being. So I'm very grateful to them for still making the space for me amidst all of that. So my practicum role was as a research assistant or intern, and done remotely, there were some limitations on what I could do, but I did get to touch on some research-based activities. And there was a fair amount of user experience design and graphic design involved. And I really loved having the chance to use my art and design and other technical backgrounds in that. And lastly, some activities were more passive on my end. This was work that was mostly complete before I came on board, but I still got to watch and learn and just have some discussion around what I was seeing. So the primary project that I worked on was a resource guide for survivors of violence in northern BC that we are making available online currently. And most of it is a directory of domestic violence services across the north. So from Atlin over to Fort Nelson, all the way down to 100 Mile House. So this fills the gap that's left by the different out-of-date directories that are out there. So I worked with Dr. Indrani to verify and update it before publishing, and I contacted agencies directly and cross-referenced a number of online sources. And because I was completing work that started pre-COVID by some grad students, the heavy lifting and the document were already well established. So what I got to add was for the usability factor, since this is a tool that could potentially save lives. Easy navigation would be important. In this case, a simple solution is direct links to maps and websites, plus buttons for quickly navigating the document, as you can see on the slide. And the secondary project that I contributed to was a literature review on barriers to accessing services for domestic violence in rural, remote, and northern settings. This started out with 44 sources, and I had to identify potential others as I worked through the initial screening. And with some guidance from Dr. Haller, I tried out some methods for reviewing and summarizing each article or report and documenting it in Excel in a research matrix. And this was a chance to cut back on screen time, so I opted to print the articles and use my computer just for writing my summaries, and using dictation to type actually really improved my pace and further saved my eyes. And lastly, this other work fits more into the watching and learning portion of my role. So Northern Fire was approached for some community-based research in the past couple years, and this was to help uncover strategies for prevention and harm reduction around hitchhiking, and that draws on community perspectives from places along the Highway of Tears. And since that project was wrapping up, luckily I could still virtually attend and witness some meetings with community stakeholders. And just in discussion at our regular check-ins, I could get a sense of the earlier parts of the process and how that all came to fruition. And I also attended some seminars. I made posters promoting the International Women's Day events that they hosted for UNBC. And it was wonderful to just kick back and hear from some people who were and are pioneers for social justice and equity in these areas that are meaningful to them. So the value that guided me most in my practicum was critical analysis, drawing on principles of social justice and equity. Because there were moments, I thought to myself as I worked on the resource guide, it probably doesn't need to take as long as I'm making it take. There will be other iterations to improve it. I could move on to other work sooner and maximize my time for myself and my hosts and all the other work that they have. But of course, that raises the question of who is going to benefit from this experience versus who should benefit from it. And most immediately, it's an academic experience for me, which is inherently privileged. And so the wider benefits for those that we're serving are more latent. So for those who need this guide for obviously far more important reasons than mine, the very least I could do is just sort of put that performance anxiety away and just take all the time that it needs to do it right. And of course, that's how my supervisors would want it done. And it's really about quality and not quantity here. It's not a race. So I wanted to share a quote from an article from one of the global health courses in the program. In this article, the authors wrote about their vision for a truly decolonized global health landscape. It is a landscape that recognizes that you cannot truly help or support people, be their allies and enablers without seeing the world through their eyes and seeing yourself as they see you. And I think that just gives a little bit more around the why and the how of how I had to approach the guide and all of its minutiae for it to be done properly with cultural safety as well as practical safety in mind. So the knowledge area that stood out most from my time was leveraging effective multidisciplinary teamwork. This was quite evident across the practicum from the projects, especially the community-driven research and our approach to the literature review, since my role was just a part of the process. And even from the stories shared by speakers at talks I attended and how they achieved their objectives. And now that it's over and I've had some time and space to reflect and consider how it's shown up in coursework, for instance, such as some group projects and my own work locally, I found that my takeaway was the potential benefits for capacity when each party is empowered to focus on what they can do best in a project. And of course, there are caveats to balancing this in groups and managing groups and expectations and goals. But generally, I think I will always lean into this going forward, especially since in health and social care, you really need all the help that you can get to play the long game and pace yourself. So moving on to the calls to action, my chosen call to action is number 7 as follows. We call upon the federal government to develop with Aboriginal groups a joint strategy to eliminate educational and employment gaps between Aboriginal and non-Aboriginal Canadians. And I chose this call to action as it's probably the most realistic one that I could contribute to or keep abreast of the progress on the calls to action, since I work for an organization that offers employment services. And one thing I can commit to is to act with humility and from the knowing that I'm not the expert and that I have listening and learning to do. For instance, since the calls to action were made just about a decade ago now, before I can be a true ally, I first need to learn about what's taken place in that time to eliminate those education and employment gaps and what hasn't yet, because surely there are a lot of things that haven't happened yet. And the Indigenous perspectives and best practices that have been shared as well, and which will be unique to each community and should guide me in my actions. So my practicum confirmed some theories I had about my ideal work settings and practices, like my need for a smaller team, ideally creating something tangible that reaches people, and having no more than 1 to 2 projects or objectives at a time, I think keeps me feeling my best and doing my best work. And my most valuable experience, and the one I'm most proud of, I think, is completing the resource guide. This was something practical to directly reach communities. It tied together skills from my earliest post-secondary training from before this program as well. So that made me feel totally justified in the many, many things that I've spent time and money studying over the years. And I did have a bit of simple advice for future students. The school really does mean it when they say to carve out full-time hours for the practicum. Because my hours couldn't be spread out evenly throughout the term, it was so essential that my part-time job is so flexible. And I'm so very lucky and blessed that everything just came together and worked out. So to wrap up, I would like to thank my hosts again at Northern Fire and my colleagues here in Hazelton for their patience and flexibility so I could finally close out this long chapter of my life. And to our faculty for all their support, to my fellow students for all our engagement in the discussions, and congratulations, of course, and to my partner for his encouragement and always holding space for me through the ups and downs. And most of all, I have to thank my mom. I absolutely could not have done this without her and all of her amazing help at home. And thank you so much to everyone here for listening.